Hi, welcome back to the Denali Medicare channel. If you're new, I am so glad that you joined us today. My name is Kendra and I am the Director of Client Communications at Denali Benefits. And today we are going to dive into Medicare enrollment periods. There are several dates that you need to keep track of, which can initially feel tricky, but I don't want you to worry. I'm going to walk you through it so that it all makes sense. And we'll talk about when you can enroll in Medicare each year, what happens if you miss those windows, and how late penalties come into play. So I recommend that you find a comfy spot, grab some tea or coffee and maybe a notepad for this one, and let's get started. If you find this video helpful, please give it a thumbs up and subscribe. I would love to be able to keep sharing these tips with you. So why do Medicare enrollment periods even matter? Well, Medicare has specific times when you can sign up or adjust your coverage, and if you don't enroll during these windows, you could face delays in getting covered or extra costs on your premiums. It's all about timing. So think of it like catching a train. If you know when the train's leaving, you can just board without any trouble, but if you miss your train, you might need to wait for the next one or pay more in order to get on another train. My goal today is to make sure that you know the schedule so that you're ready to go. The first enrollment period that I want you to understand is the initial enrollment period, or IEP. This is the window when most people sign up for Medicare, and it's tied directly to your 65th birthday. The IEP lasts for 7 months. It begins 3 months before your birthday month, it includes your birthday month, and it ends 3 months after your birthday month. So for example, if your birthday is in July, your IEP is going to run from April 1st all the way to October 31st. And during this time, you can enroll in Medicare Part A, which is your hospital coverage, Part B, which covers your doctor visits and your outpatient care, Part D, prescription drug coverage, and then either Medicare Supplement Plan, which is called Medigap, or a Medicare Advantage Plan, which is called Medicare Part C. Now, did you catch all of that? It's a lot. If all the names are confusing to you and sounded like alphabet soup, check out the other videos that we have that explain Medicare Parts A, B, C, and D in more detail, and I will link to those in the description. Now, enrolling during your IEP is going to help you to avoid late enrollment periods, and it ensures that you won't face any health questions or coverage delays, so it's really important to get enrolled on time. Now, what if you miss your initial enrollment period? Maybe you're still working or you thought that you didn't need Medicare yet. Well, that's where the general enrollment period, or GEP, comes into play. It's going to run every year from January 1st all the way to March 31st. And if you didn't sign up for Part A or Part B during your IEP, you can do it during this window. Just know that if you enroll during this window, your coverage won't start immediately. It always is going to start the first of the month after enrollment. And you might end up with late penalties, which I will talk about more in just a little bit. Remember my train analogy at the beginning of this video. If you can think of the GEP as catching the later train. So you're still getting where you're going, but it might cost more and it's going to take longer. So it's really best to enroll during your IEP and to avoid all that hassle if you can. Now let's talk about the annual enrollment period, or AEP. Unlike your initial enrollment period, AEP, or your annual enrollment period, isn't for signing up for Medicare for the first time. It's for people who already have Medicare and they want to make changes. AEP runs every year from October 15th to December 7th, and it applies to Medicare Advantage plans, which is Medicare Part C, and prescription drug plans, which is Medicare Part D. You can switch from original Medicare to a Medicare Advantage plan or vice versa during this time. And you can also update your Part D prescription drug coverage, or you can change from one Medicare Advantage plan or carrier to another one. So think of the AEP as your annual opportunity to fine-tune your Medicare coverage. If your prescriptions have changed, or if you're looking for different benefits or a different doctor or different network, then this is the time to make those changes. Any updates that you make during AEP are going to take effect on January 1st of the following year. Now, at Denali Benefits, we work with all of our clients during AEP to review their options and make sure that their coverage is still right for the year that's ahead. Now, you may have heard about Medicare Advantage open enrollment. Every year from January 1st to March 31st, if you already are on a Medicare Advantage plan, you have a window to change the Medicare Advantage plan that you're enrolled in for January 1st. You can switch to a different Medicare Advantage plan, or you can go back to original Medicare. And this open enrollment period doesn't apply to Medicare supplement plans or to standalone Part D prescription drug plans. But this is your chance to make sure that your coverage still fits your life, or it's an opportunity to make a change to your Medicare Advantage plan if you find something about it that doesn't really work for you, like a very important provider who is out of network. Now, life doesn't always stick to a schedule, unfortunately, and Medicare does account for that with something called special enrollment periods, or SEPs. These are time-limited windows that let you sign up for Medicare or change your coverage outside of the standard enrollment periods, as long as you've had what's called a qualifying life event. Now, some examples of qualifying life events are things like moving to a new area that affects your Medicare Advantage or Part D plans service area, losing your job-based or union-based healthcare coverage, or retiring after age 65. So let's suppose that you're still working past 65 and that you have group health plan coverage based on your or your spouse's current employment, which typically is going to be if your employer has 20 or more employees. And in that case, you can actually delay enrolling in Part B and not accrue any penalty. When that employer coverage ends, like when you retire, you'll qualify for a special enrollment period to sign up for Medicare without facing any late enrollment penalties. Now, SEPs give you flexibility when your life changes affect your healthcare needs, but the timing and the length of your enrollment your enrollment window, can vary depending on your situation. So some SEPs can last 2 months and others might last for 8 months. So it's really smart to talk with a licensed Medicare agent in order to understand your options. Okay, it's time to talk about late enrollment penalties because they're a big reason to make sure that you understand the various enrollment periods. You could face extra costs if you miss your initial enrollment period and you don't qualify for a special enrollment period. Now, Part B's penalty is 10% of the standard premium for each full year that you delayed enrollment. So say the standard Part B premium is $185 a month. Now, if you waited 2 years to sign up, you'd pay an extra $37 a month for as long as you have Part B. Now, $37 a month might not sound like very much, but over the course of 10 years, it's more than $4,400 in penalties. Now, for Part D, the penalty is about 1% of the national base premium, which is going to be around $36.78 each month that you didn't have drug coverage. If you went 12 months without it, that would be an extra $4.40 every month. Now, these penalties are going to stick with you for life, so enrolling at the right time is going to save you money. If you want to avoid those penalties and stay on top of enrollment, we have a few ideas for you. First, we recommend that you set a reminder. So if you're getting close to age 65, mark your IEP dates on your calendar. Second, you want to watch your mailbox. Medicare and many Medicare agents are going to send you information as you approach age 65, so keep an eye out for that. Third, check with your work. So if you're working past 65, ask your employer how your health insurance plan pairs with Medicare. And number 4, of course, we're going to recommend that you ask for help. Talk to a licensed Medicare agent like those at Denali Benefits, and you can get clear directions from someone who knows the ropes. Medicare enrollment can feel so much more manageable when you know what's coming. So that's our rundown of Medicare enrollment periods to help you know when to enroll each year. I really hope that it clarifies things and gives you a solid starting point. And if you have any questions, please reach out to us. We're here to help. And if you liked this video, please give it a thumbs up and subscribe for more Medicare insights and tips. Thank you for hanging out with me today, and I will see you in the next video.